Useful. So, I want to invite our panelists to talk, and I have some questions for our India colleagues, but also some colleagues here from the US, including our speaker, Dr. Lamaya. So, again, thank you, Dr. Modi, Dr. Joshi, Dr. Rajneesh Joshi, and Ankur Joshi for leading us to the discussion. So I think we've addressed some of the basic tenets here of vaccine hesitancy, right? So one of the challenges here is that the literacy amongst your patients is highly variable. And there's also been changing policy, which has led to confusion. And the underpinning of a lot of hesitancy seems to be fear, right? That's what we saw in the cases that were presented to us. So Dr. Ankur Joshi, I want to start with a question to you. In your experience in treating patients in India, which populations or individuals in particular seem to be highest risk of not having adopted or had taken the COVID vaccine? Is there any specific populations that stand out? And we'll keep our answers brief if that's okay, because there's a lot of questions I want to get through.
Yeah. So as far as India concerned, we have a very wider experience in the immunization previously. If we take the example of polio, so there were some section of the society like migrant workers, like persons who were wandering, homeless, and so these were the sections from some sections of the tribal people. So these are the sections who were because of their specific geocultural issues or their socio-economic issues or their socio-cultural vulnerabilities could not be incorporated into routine immunization process. So, but at this time, as we had our experience from the pulse polio immunization, so all these sections were duly considered and duly entered by the microplan formulation. And believe me, now this microplan is available at every village level as far as COVID-19 vaccination concerns.
Thank you very much, Dr. Joshi. I want to invite Dr. Prem Singh. The next question is for you. Dr. Singh is the RISE India vaccine technical lead here. And, as I said, as healthcare workers, many of us may not be engaged directly in vaccine rollout, but we do engage with patients. What are some of the languages that we should avoid when talking to patients about uptake of vaccines? Is there any guidance that has been provided or issued?
I think, first of all, like while talking to any patient, we should be very clear. We should be listening more rather than informing them. So it is basically what are their queries, what are the issues they like, what are their queries related to vaccine, what are there might be some rumors, misconception which are spreading. They might be having that. So it's good to first listen to them, to know them, to identify what communication challenges are there, what issues related to vaccine, what are there, and then address related evidence related to that issue. So that is important. So address to the specific issue. We should be definitely polite, and we should not be harsh when we are talking to them. It's not only the medical, definitely medical people are, it is very good. There are cases where medical people can answer most of their queries, but general mobilizer like ASHAs and who are mobilizing, they can be trained in specifically in counseling skills so that they can address these issues, how to talk to them, how to resolve their issues, what are frequently asked questions which can come, and we can train them so that they can resolve those frequently asked questions. They can answer that, and any rumors, misconception, or any doubt related to vaccine can be addressed.
Thank you, Dr. Singh. So I'm hearing motivational interviewing and answering the specific questions. So not avoiding the questions that individuals are presenting to you, no matter what your opinions are. Dr. Rajneesh Joshi, one of the challenges that we have faced in the United States here has been that even within health facilities, there are certain sectors of care providers who have been hesitant to take vaccines. So is this a problem in India as well? Are health facilities themselves seeing healthcare workers avoidant of vaccines? And if that is the case, what are some of the strategies that the health facility leaders have adopted to improve vaccine uptakes in healthcare workers?
Okay, so in India, vaccination for healthcare providers actually started in month of January. That was when the first wave had ended and second wave was yet to come. There was much greater hesitancy in January and February when we were kind of towards an end of the first wave, and general belief was that probably this may be the only wave and we would do something different. While there were many apprehensions, but healthcare workers, especially medical and nursing personnel who have directly given care to patients with COVID-19 infection, were more receptive in terms of believing that it's not a natural immunity, which is the only one which is going to work. Many of the more inquisitiveness even went on to get their antibodies done and figured out that it's not a universal truth that somebody who has had even a prior COVID infection has antibodies now. So some more educated ones, like the neurologist who will worry about Guillain-Barré or some kind of encephalitis, or a cardiologist who will worry about vascular occlusions, may have had a greater hesitancy. But when it comes to nursing staff, support staff, security guards, where there was more of an acceptance and a much greater acceptance of the vaccine, and vaccination rates were kind of fairly good. Second wave changed it all. Second wave was kind of devastating, and we really had very high mortality, especially in the hospitals and also outside hospitals. And I think most healthcare workers got vaccinated by the time second wave had hit them, though even those who were hesitant early. So my take is somebody who has experienced and seen the disease will always get vaccinated early. And there would be some concerns, but eventually, looking at the severity of severe COVID infection, healthcare workers adopted it. Maybe more educated ones adopted it slightly later as compared to, so-called less professionally educated individuals in terms of support staff. And I see that kind of a divide playing out here. I hope it answers what you had asked.
That very much does, Dr. Joshi. And one of the campaigns that we saw here on Facebook was have you seen someone die of COVID, and you had to name your experience. And I think that led to awareness that this is so real. Dr. Chris Morgan, welcome to the call. Dr. Morgan is our Senior Technical Advisor for JPIGO in the area of vaccines. Dr. Morgan, if you're available, the next question is for you. So one of the biggest challenges that India faces, there is a plethora of different vaccines available. We have a mixed vaccine environment. How do healthcare workers talk to patients? What is some of the messaging that can someone please unmute Dr. Morgan, please? What is some of the messaging that we need to adopt when patients ask us, like, which is the best vaccine? Or which vaccine should I take? Covaxin versus Pfizer versus Johnson & Johnson. Are you able to address some of the strategies that have been adopted, Dr. Morgan? JPIGO India, are you able to unmute Dr. Morgan, please?
Should I?
Yep, I can hear you, Chris. But now you're muted again.
Good evening, everybody. I think the mixed vaccine environment is very difficult. I think when even in settings where more than one vaccine are available, they're not all available at the same time. So our consistent advice is still the best vaccine is the first one that you can get access to. But for clinicians providing advice and services, there does need to be different advice provided to the client according to which vaccine they've received, particularly in which very rare side effects to watch for. So I think on that side of things, there does need to be some distinction. And I think there is a particular issue with pregnancy and hesitancy, particularly in India with the Bharat Biotech manufactured vaccine which has some new components where less is known. There's every reason that it should be safe, and we certainly agree with the Indian government's provisional licensure of its use in pregnancy. But it's true that there is much more known about the AstraZeneca and the mRNA vaccines in pregnancy. So across those three, we know that they've been used, they've been well tracked in over 200,000 pregnant women. And there's at least 8 studies in 4 countries that show that they do not cause problems for the mother or the newborn baby. So I think we do have to be aware that the evidence is slightly different by the 2 vaccines in common use in India. But the more important point is the one that was made earlier, that the risks to the newborn baby of prematurity needing intensive care or stillbirth, and the risk to the mother of maternal death or needing ICU from the COVID infection itself are far, far greater than any theoretical risks of vaccination. So we really need to keep on message for that one. Thank you for the chance to comment.
Thank you so much, Dr. Morgan. And so all of these experts that are here today are also on the chat. If you have questions, put them in the chat. Prem, Chris, Dr. Joshi, Ankur Joshi, Dr. Rajneesh Joshi, and Dr. Jyoti, please engage in the chat. I'm going to hand over.